I'm Doreen Watson and I work with the Joint Improvement Team's Action Group for Telecare. And I'm here because I'm really interested in both the telehealth and telecare agenda. I think the agenda to bring health and social care together is making strides and making inward strides to providing more like within the community. I think telehealth and telecare will improve that because it allows people to have the care when they need it and not programmed visits to check on people. And it's probably the least intrusive, which is what people want, I think, to be able to live their lives. But in their own homes and more importantly I think in their own community. The whole world's trying to do the same thing. They're trying to integrate people's health and care and they're trying to make that accessible at a community level rather than hospital-based setting.
I'm Linda Saunders. I'm the Telecare Development Manager for Falkirk Council. And my purpose in coming to the conference today was to keep myself updated about what's happening in telecare and telehealth in Scotland and in Europe. I think there's still a huge amount of work to be done. I think what we're beginning to see is the very beginnings of the integration agenda between health and social care. But I'm not so sure that we're seeing the same kind of progress being made towards the integration of telecare and telehealth. And this conference, for example, is a clear example of there being a clear focus on telehealth, but hardly a mention of telecare at all. Which I find quite surprising considering the hard work that's been done across the whole of Scotland in the last 4 or 5 years to progress the telecare agenda on its own with the funding from the Joint Improvement Team during those years. I think the key piece of learning I'll take away from today's event is that there is a lot of progress being made in relation to telehealth care and particularly to telemedicine, but that there is still a huge agenda that needs to be addressed to ensure that telecare and telehealth care are inclusive in the progress that's being made within Scotland.
My name's Heather Lang. I'm the Manager of Assessment and Supported Housing Services within the City of Edinburgh Council, and primarily that means I manage the technology services within the City of Edinburgh. So I'm here today just to get a feel for the wider telehealth, telecare, telemedicine, find out what's going on and where we fit into the wider picture, particularly in the links with social care. As part of a wider package of support, technology is playing into that, so it's having a major impact. I'm looking to see where our European colleagues are, if there's anything we can learn from them and bring back to our own house, but it's particularly about sharing what we're doing with them and taking things forward for them as well.
My name's Ian Fricker. I'm from the Scottish Social Services Council here in Scotland, and the purpose is that I'm the project lead for an assistive technology project that's a UK-wide funded project. I'm part of workforce development, and the project I'm concerned with is upskilling the generic workforce to become confident and competent, not only understanders of technology but users of technology, because one of the biggest barriers is not the technology in itself but the understanding and appreciation by the kind of generic workforce out there, the social care workforce, who have resisted that kind of learning and tend to take a wide swerve if they're not directly involved with technology. I suppose in the round it's the inevitability of technology becoming a key part of everybody's care in all aspects, and so that the need for upskilling the workforce is even more prevalent, more imperative than maybe 5 or 6 years ago.
My name is Suhan. I work as a program manager with the Centre for Connected Health and Social Care, which is part of the Public Health Agency in Northern Ireland. The reason why I'm here today is Northern Ireland is very similar to Scotland in terms of the problems that we have with the elderly population with long-term condition, social care issues, and therefore I'm hoping through this actual conference we'll get to meet people with ideas and innovation and things that we can actually learn and share our ideas with what they have over here. Well, in Northern Ireland we have implemented a telemonitoring service which is across the whole region, so patients have been benefiting from being able to measure their own vital signs in their own home, and this has helped them tremendously in looking after themselves, not having to travel to hospitals. They're able to monitor their own condition in the home, look at the readings, learn about what actually, we know how lifestyle behaviours can actually impact on their health, and again it provides them and their carers a level of reassurance as well that they're actually on top of their conditions, they can actually look after themselves. Lots of people who are very, very keen to develop new ideas, and actually there is probably going to be solutions for all of us, and probably again just learning from a lot of other people and listening to the experience to date.
I'm Margaret Worski and I'm Director with the Joint Improvement Team, and we're hosting the series of events this week with our colleagues in NHS 24, Scottish Centre for Telehealth and Telecare, and our European partners. So this has been a very important event today, and really all the activities around the Telehealth and Telecare Week to the work that JIT's involved in with regard to really supporting the sort of service redesign and changes that we need to see in order to address some of our challenges and to achieve the outcomes we would want for people. But in terms of telecare, which JIT had a key role in developing, you can now see evidence that telecare is becoming integrated into the way social care in particular develop and assess individuals and support plans. So I think telecare has a minimum impact for some people in terms of just some security and some safety. But I think for others with sort of higher needs, I think it provides a much greater supportive environment, reduces risk and allows people to remain as independent as possible. I think the real opportunity though is in terms of how we integrate the telehealth and telecare agenda, and clearly we've got a number of areas of work underway. We're working with our European colleagues on smart care and United for Health, which again brings us huge opportunities to learn from our European partners, but also for Scotland to share some of their experience. And as we go forwards to health and social care integration, again I think how we can integrate the tools and techniques we have, I think, to focus on those people that need our support and care. I suppose one of the key pieces of learning is that none of us have the answer, so I think it is about us working really collectively together to share our learning and the developing evidence base. And I think as we continue to do that in dialogue with colleagues in the UK and colleagues in Europe and beyond, I think that will help us navigate, I guess, some of the uncharted territory that we need to go forward in. So for me it's really about making the connections, and none of us as smart as all of us really, and we need to continue to collaborate and to learn from each other as we go forward.
Sure. I'm Ed Brennan. I am president of a division of Samsung, Samsung's health medical equipment company, which is located in Korea. My company is located in San Diego, California. Samsung sees that consumer electronics are going to become more applicable to people in the home and people managing healthcare in the hospital and in the organized systems. So that means that we should be moving our technology and our concepts into those arenas. And the second reason is we have some particular expertise in both the technology side, but we're developing that expertise in the software and the medical system side. Ultimately, telecare and mobile solutions have to be more efficient or provide better outcomes. Otherwise, they're not going to be adopted. Because ultimately, it's all about how do we control the costs around healthcare and how do we make it more efficient in delivery.
My name is Marlene Harkis. I'm a Service Development Manager with the Scottish Centre for Telecare, Telehealth, and NHS 24 hosts that service. I've just started to work for the organisation quite recently. I've previously worked within local authority, within social work. I've worked there for 30 years. So this is quite a change for me, and it's an area that I'm particularly interested in. There's work that we're involved in already that's building blocks that's taken us part of the way there. I think technology, though, is going to play a significant part in that. Part of the work that I'm doing is looking at the falls pathway and how we use technology to better coordinate services, looking for a shared care mechanism for both health and social care practitioners and for the service user. To coordinate the information that's going to bring about better outcomes for them. I've learned quite a lot today. I think for me in this new job, I'm still learning about the potential of technology, and I think there's really innovative providers here today, and that's the key thing that I've learned is how advanced it is.
My name is Alistair Hodgson. I'm from the Joint Improvement Team, which sits across Scottish Government, COSLA and NHS Scotland, along with the third independent and housing sectors. My particular role is I have a policy responsibility for telehealth and telecare. So I think for me personally this is by far and away the most important conference that I'll attend all year. Not just so that I can make sure that the message about what's happening around telehealth and telecare within Scotland actually reaches a wider audience, but also that the people in Scotland can actually understand what's happening elsewhere in Europe and realise that people are facing the exact same barriers, the exact same hurdles, but have the exact same ambitions as we do in Scotland. Well, I think, I mean, as you know, I think telecare has been around for a number of years, and social care has been far ahead of healthcare in that regard, of actually utilising technology in people's own homes. So I think now that we're actually bringing social care and health together, it becomes much easier, I think, for the world of telehealth, if you like, to learn from what telecare have already gone through. They've had to go through the exact same barriers about getting professional buy-in about utilising these technologies. Whatever the type of technology is, it still at the end of the day represents a new mode of delivery of services. And I think the fact that they've been doing it for 20 odd years, they know how it's done. They know how to assess people properly and how to actually understand the needs of individuals within their own homes, which I think is a vital lesson that health will be able to learn from their colleagues within social care. So now that you're actually bringing the two together formally under our legislation we're putting through Parliament, I think it will make the growth of telehealth will be far more rapid, actually, as a result of having that marriage with social care. I think the key piece of learning for me is the fact there is such global enthusiasm and support for this agenda. We're not working in isolation within Scotland. We have the support of multinational companies. We've seen some companies here, likes of Samsung, IBM, the massive companies that are prepared to invest in Scotland. They're prepared to actually look at what Scotland's doing, and the fact that we're integrating health and social care in advance of many countries who are all interested in integrating health and social care. They see Scotland as being very much a pilot country for the whole of Europe, and they see the fact that we're at the vanguard. And I think, to me, the overriding energy in today's conference has been the enthusiasm for all things telehealth, telecare, telemedicine, whatever they want to call it.